Thank you for joining us, Dr. Goebert. She comes to us from JABSOM over on Oahu, and she will be sharing with us on um, suicide prevention. So thank you.
Rearrange you all. Okay, so I can try and see if questions come up. Excuse me. Please feel free to interrupt me at any time. I'm okay with that. I do have a little more challenge monitoring the chat while I'm presenting. So if you can help with that and let me know if there's anything immediate. Again, feel free to break in. I'm going to be talking to you today about suicide prevention. It's my passion work. I think that's the best way to describe it. I've been working in this field for maybe 25 or so years now, and helped to establish the Prevent Suicide Hawaii Task Force. But most of my work is with youth. So I just wanted to give you a little bit about who I am and sort of the lens that I look at this through. And what my supports are, because I think, as the title suggests, we're going to take it from a resilience standpoint. And so you can see perhaps from the photos, that is me in the past and current pictures. I grew up on Oahu on the windward side. And for me, place is very important. I do, except today, didn't get out. It was pouring down rain, but I like to walk the beach every morning. I love to look at the ocean, but I also love looking at the mountains, and I live in Kaneohe. The people that I work with are important and part of my family, as well as a large multi-generational family that I get to see on a routine basis, and then taking part in activities. But you'll see that my activities also focus around land and sea type of things. I like to spend time on the ocean or in the mountains. I also like to do crafts, but that didn't fit my theme. So in doing this work, I really want to acknowledge those that have lost someone, those that struggle, those that provide love and support for our families and for our communities, which basically means all of you, as well as my team at the Hawaii Caring Systems Initiative for Suicide Prevention and the task force. It's a great community to be a part of. It's very supportive. I do have some funding from National Institute of Health and from the Substance Abuse and Mental Health Services Administration. I also want to acknowledge that in talking about suicide, and in particular at the holidays, these can be challenging times to be thinking about these topics, and just loss in general, because it's a time where people are gathering and remembering, and so it can be challenging for folks, and I want to be sensitive to that. So please take a break if you need to. If you need to reach out, let me know. I can also do a follow-up conversation with you if you feel you need that. So I want to start with a parable about a river. And one day, Auntie Pua was walking along the river, and she heard shouts coming from the river. And she looked in and saw a child struggling in the water, and immediately jumped in and pulled that child to safety. She typically walks this river every day. And so the next day she was out, and she saw another child in the water and rushed in the water and pulled that child to safety again. And before she'd even caught her breath, another child came down the river, and she pulled that child. So the community came together, and they set up training programs and created a lifeguard program and put up towers. And Auntie Pua was quite concerned. And one day, some of the people were actually going over the river. They set up support groups, and she headed upstream to see what was going on. And everybody called her back. "We need your help. We need your help. Where are you going?" And Auntie Pua said, "I need to see what's happening upstream." And so that the work that we do, we often think of as kind of radical upstream prevention, and that's because we're focusing on those skills and resiliency factors. That's not to say somebody might not slip through and head down the river and need other forms, and that we might still not have deaths, but we're trying to minimize that. However, if you look at suicide prevention as a whole, most of the funds go into that crisis moment, and I'm sure you're all aware. That's when people are coming in. That's when we see them, and what we're trying to do in prevention work is to really move that upstream. In particular, a lot of our folks too that are engaged in postvention work, which is after a suicide loss. That's when they start getting involved in suicide prevention work. This parable is very common to be used in the suicide prevention realm to look at that whole spectrum. What I think is interesting is when I spoke with Native Americans, they said, well, in our story, this is actually all the same person. The person that does each piece, right? Everybody has a role. And we have often said that suicide prevention is everyone's kuleana. So we all have a role in this, and it could be in multiple levels. So the first value that we bring to the work that we do in this is aloha. And for us, that's really that unconditional giving, no expectation of anything in return. And if we approach the work that we do from that perspective, then people feel cared for. Throughout these, I have put in some of the social media, and these are actually posters that appear at all Maui County schools, because we did a messaging campaign with them, and different schools created different posters. And this was two of the posters, one from Molokai and one from Maui High. But you can see that aloha came through for them as important concepts. The second one is a valuing of life. And our youth on Hawaii Island felt that this really spoke to them. It's life in the house of life. So it's that recognition that everybody has ups and downs. And so what we want to do is learn to deal with those ups and downs and to support each other when those are occurring. And this is quite a long story, but it talks about the relationship, Pelina, between the koa tree and the vine, and that at different points in time, one may be the strength. So people always think of the koa tree as the strength, but there are times and in certain winds where the vine is really helping the koa tree. And that is to say that we all need to rely on others at some point in time. This is a project we're currently doing. It comes from a program called Sources of Strength that we are now implementing on islands across the state. It's also being implemented in the Commonwealth of the Northern Marianas. And in the upper left-hand corner is the original design, and we are in the process of translating it into languages of Hawaii. And there are many of those languages, as you can see. It's been a very interesting thing to look at language and what it means to belong, and the nuances there. Do we belong to a place? Do we belong to each other? Do we belong? Are we accepted, and are we allowed to live here? And so all of those different types of definitions have come up, and it's been an interesting project to look at what belonging actually means. The other thing that we do is that we're recognizing culture and its importance. We do believe that the work that we are taking part in prevention requires us to look intergenerationally, that we can't work with youth without working with kupuna, our elders, for example, that we need to do things more experiential. Not everybody learns in the same way. And so when we're trying to work on coping skills, we need to be sure to do those. So we actually do a lot of games and metaphor, storytelling, and that we're seeking to balance And so we'll share some more about that as we go on. So one thing that's been concerning is, and maybe you've seen it as a result of, for example, the Maui fires. There's been several things that have come out that have said way more people are dying by suicide, and we have to do something, and it's contagious. And the way that it's being talked about, actually, just first off, for the facts, there have not been any more suicide deaths than there usually are in Maui. That may be the identified triggering event, but it is just one of many things because it's a complex issue. But that can pull away, right? It can be like, oh, I'm suffering too, and it doesn't feel like any, and it gives this as an option. And so that's something that we're trying to do to make sure that we're talking about suicide in a way that allows people to get help and not in a way that encourages suicide. So talking is the first step. So we want to make sure that information, when we share it, is it reliable? Social media has totally changed the way we look at this, and just many different things. It's like, okay, well, where did this come from? And is this something that I can actually cite? And do I have the information on that? When we say positive stories, we're not talking about that toxic positivity, but we're talking about that there is treatments available. Loss can be complicated and it can take a long time and it's a winding road, but it does get better, right? But we don't want to say it's going to be better tomorrow. That gives people false hope, and when it doesn't occur, that can be a problem. And then we also want to make sure that we're providing people with information on how to get help and ways to do that. So some of the do's, I think in the medical field, some of the languages that I don't hear as much as I used to, but we're trying to say like a suicide death or a suicide attempt. One of the most common ones I hear in the medical field is completed suicide and committed suicide, and we try not to say those, in part because when we say committed, for example, it has connotations associated with a crime or a sin. And so those are things that we're trying to stay away from. And again, in the medical field, people often talk about the reasons, the causes of suicide death. They talk about the means when they say that, right? They're really looking at the means of suicide death. And we don't like to share those, especially with youth. So staying away from sad, shock, trauma types of things, like this is an epidemic. That would be a shocking kind of thing to say, but that prevention works, resilience works, we have effective programs. And again, I mentioned, and based on a national survey that was done, 94% of students over the age of 12 use social media. So that really is a place that we're looking at and how to share that. We just did a project locally to see what kind of messages work, not only for youth, but for people of all ages and what they wanted to see. But again, you can see some examples here. You don't have to have only good vibes. All vibes are welcome. So we want people sharing that, not everything is perfect. But again, also sharing. And if you need someone to reach out to, here's where you can go. And there's ways to actually report. So this is great information to share with youth and with families, that if they see something, they don't have, if they're not comfortable saying something to the individual themselves, they can report them. And then they'll get information, for example, on Snapchat or Instagram. They'll send them like a link to 988 and the text line, for example. This is just another social media campaign that we did out on the Leeward Coast. And just for posting, that again, seeing familiar faces saying we care. So what do the numbers look like? These have been changing recently. Suicide had been the leading cause of injury death in Hawaii for a long time, and it's now number 2, in part because poisonings have gone up, and those are unintentional poisonings. However, for our young people, 15 to 29, it is still the leading cause of injury death. And if you look at those numbers, you'll see it's more than poisoning, motor vehicle crashes, drownings combined. And based on national estimates, for every one suicide death, they anticipate that 132 people are impacted. Although I believe in Pacific communities that those numbers would be higher because we don't have 6 degrees of separation. I think generally we can find a connection to each other in 2 or maybe 3 at the most people. So this number is likely higher. And deaths, of course, are only the tip of that. The recent data suggests that we have about 190 suicide deaths in Hawaii per year, which is, and another 300 hospitalizations, nearly double that in terms of emergency department visits, and over 900 poisoning hotline calls. And then again, there's so many more that don't ever get counted in any of these numbers. We do get data from the Youth Risk Behavior Survey. This is done every 2 years. It's a representative sample. It's mostly public schools, but also includes private schools. They don't do it as often in other locations, but there is some data from other parts of the Pacific. The first largest circle that you see there is that 2 out of 3 students, and these are high school students, 2 out of 3 students felt sad, empty, hopeless, or angry or anxious for 2 weeks or more, so that they stopped their usual activities. This is our screener, right? When we think of screening for depression or anxiety, it's a huge number of youth that are going to screen positive for that. And then 1 or 3 is specifically depression, as opposed and sad forms of depression, because it doesn't include the angry form, which is more common, particularly in adolescence. 1 out of 6. So in every classroom, about 4 students have seriously considered attempting suicide, and most of those that consider it go on to make a plan. And that's not unusual during adolescence. That number gets spread apart a little bit more as you move to adulthood. And 1 out of 10 actually make an attempt. The number that actually die by suicide is 1 in 9,000. I think of this slide as a hopeful slide. Perhaps it doesn't look like it on first review, because these are all things that we can identify. And because we can identify them, that means we can intervene in some way. And so that's where I see hope. So in this area here, this is usually where medical providers get involved, but you can also, if you have screening early on, get involved much earlier. And so these are all intersection points. The data for parts of the Pacific are similar, actually. They do say that it's actually indigenous people have the highest rates of suicide among youth in the world. And that includes Pacific Islanders. And so depending on what you look at, you'll see that these rates are among the highest in the world for suicide deaths. The reporting is a little bit harder for screening, and they don't ask all of the same questions. So there's a little bit apples and oranges here in terms of the numbers that you're reporting. I just wanted to share some of the information from other parts of the Pacific. And we do see that in Hawaii as well. We have previously thought that Native Hawaiians had the highest rates in Hawaii, but we now have sufficient data to look at Micronesians populations in Hawaii and pull those out, and they're actually higher than our Native Hawaiian populations. Again, among youth. And so you see those also when you move out to the freely associated states. So let's talk hope. I like this better. So much data you can handle. I say that as an epidemiologist by training. So what are the things that we can do? Community awareness is one of them, and trying to increase that. That's and we are trying to enhance our social media presence. The 988 number in particular in Hawaii Cares, I don't know if you've noticed, but this year they have definitely launched a social media campaign and have gotten a lot more information out than they had in previous years. Training also helps. So that's another part of the hope. But anything that can lead to connection. And so this is from suicide prevention trainings. This is what I identify. I still see this overall link as being connection to an adult, having school safety, feeling like school is a place that you can go to, having friends, overall resilience, having your feeling safe in your neighborhood, and being aware of access to services. These are all different ways of connecting to family, school, community, healthcare, right? Connection. Some of these Hawaii has been a lead in defining, and that is because, for example, the connection to other non-parental adults was part of the Hawaii Resilience Study, which is now moving into 30 plus years, where they followed folks and have shown that having some connection, any connection to an adult is powerful for youth, even 30 years into the future. But we can go back even further than 30 years in looking at that kind of connection. And we can look at some of the ancestral knowledge. And so if we look at the type of connectedness from a Native Hawaiian worldview that has been passed down, we can see the spiritual connectedness that can mean that you're never alone. It can also link you to gratitude and thankfulness. Aloha Aina, connectedness to the land and the water, connectedness to family, right? And the large extended communities, and not just our birth families, but also our Hanai families, right? Lots of connections there, as well as connection to the community. So it's not surprising. We did a study on the leeward side of Hawaii. This is the Sources of Strength program. It seeks to enhance your ability to respond to life's ups and downs by increasing your resiliency and building your strengths. So we already have some of these strengths, obviously. And so usually what's done in one of the activities that we did is we actually did these posters. And so from the posters, we dissected the images and the conversations and the words that people use to describe them. And we pulled apart different aspects. And so the number one thing, and again, people are drawing, that folks tapped into were these healthy activities, right? And that makes sense. Easy to draw pictures of healthy activities. When people think of what helps them, they often think of activities. These are not all like, oh, do you participate in sports? They can also be things like, I like to bake, or I like to play some video games, or whatever, right? There are different types of things that you might exhibit throughout that. They also tap into a huge impact with spirituality. So that makes sense, especially locally. These numbers are higher than other places. People tap into these, but usually these are areas they say they want to build. When we think of spirituality, we're looking at all those different things that I mentioned on the previous slide. So they can be religious practices, such as prayer. They can also be anything that lifts your spirit. So it can be tapping into nature. It can be tapping into culture, and also that thankfulness. And then, of course, people. And this one was really interesting for us. We had a hard time distinguishing. Most people, when they describe their friends, if their friends are that close and they've been there, they talk about them as family, and mentors almost always were considered family. So we we really ended up with it's hard to distinguish these as separate areas. The area that wasn't on the wheel, that folks really felt was important, was community. And they did say that they tapped into their communities. And so that's come up as we've tried to implement this in other places. So when we look at resilience, it comes up all over the place. So this program is meant to be done kind of group, either in school or in community, where you bring folks together and they not only share and have conversations that build their own strengths, but then they also try to share that out. However, we're also seeing now that some of our clinicians that have been exposed to the programs are taking those back to their offices and using it. And so they're just having conversations about what's working for somebody. How can you tap into that? And it doesn't have to be a long conversation. It's just a picture of the wheel. What is the support that's working for you right now? What is one of these strengths that you're relying on, and having them talk about it? And then what's something that maybe you want to build on before the next time we visit? And so very short 3-minute conversations where you can build on those strengths. And so this is just an example of like one of the messaging campaigns that we did out of this. It was actually for social media. The youth took pictures of things that brought them strength. And this was one that took a picture of their ukulele, and then they talked about what that meant for them from a mental health perspective. And then that gets shared out, and then people add on, and now they're talking about doing photo dumps. I mean, there's always something, but there's different ways that can be shared. I think the key thing is that this program is supposed to take about 3 years to take hold. We had funding for to measure it for 1 year. At the beginning of our program, we found both youth and adults, about 1/3 of them reported having a plan for suicide. That's 1/3 of the adults in the community, and one that were trusted adults. These are the folks that the youth are relying on, and 1/3 of the youth had a plan for suicide. But after 1 year of the program, it was 4% of adults and 13% of youth that had a plan. And the psychologists in the schools reported that they were coming in sooner, that they were more open to treatment as well. So we felt that this was really impactful in even just a short time. And again, you can see here that they just have the community as a strength was huge for at least the Leeward side of Oahu. We were in Nanakuli and Waianae. Yeah, lost my cursor. There we go. Okay, so let's talk a little bit about help. The warning signs for suicide are really pretty straightforward. There's 3 to look out for. The first that most people see, the first thing that's seen is kind of changes in mood, and maybe withdrawing from activities. That moves it into the behavior side. But yeah, so we do spend a lot of time talking about like, what are those moods? How do you deal with anxiety? How do you deal with depression? What happens when you're a hot mess and your moods are going all over the place? And then also, what are we looking for, particularly in young people? I shared the adult data, but the data we're actually seeing greatest changes is actually in the middle school ages. Adults have been, the adolescents have been pretty stable, but the middle schoolers we've been seeing increases, so it's happening at a younger age. So sleep is a great access point across the board to talk about things. It's a very comfortable area. How have you been sleeping? Good conversation opener to talk about sleep. And people will say, I'm in bed all the time, but that's not the same thing as sleeping. And then anytime people are talking about suicide in any way, and or death, and we want to take all of those things seriously. So these are some quotes that come actually from youth in Hawaii, and we said, what does this look like to you? Generally, they're not saying, I want to die by suicide. That's not the words coming out of people's mouths. But they might say, I'm not okay, I'm just good at pretending I am. Or pretty soon you won't have to worry about me, right? And so those are the types of things that we're listening for. 85% of youth do tell somebody. A lot of times, and especially now, that is through social media. So it's just being put out there to see who's going to respond, or it could be to friends, which is why we're trying to make sure that the friends can connect them back to the adults, right? Like we have all these eyes and ears out there in the community, and at some point they can get referred. So we did do a study. It was trying to integrate some of the recent literature for Hawaii. And it is important to do local literature, so local studies. The national studies had showed that if you posted in blue colors, that it may be a sign that you're feeling depressed. People put blue colors out. But when we did that in Hawaii, the exact opposite was true. Blues and greens and the type of pictures that came out in those mostly were pictures of nature. And when people were taking pictures of nature, that usually meant that their emotional health was strong. It was when they put pictures of red or close-up pictures of body parts, or pictures in black and white, that we started seeing things. So it was very different from what we were seeing in other places. Another interesting thing, just because I'm fascinated, we used artificial intelligence to do this project, and they thought a lot of the pictures locally were adult content, is how they labeled them, and that's because people posted pictures in bathing suits. So that was also a cultural change that we had to make. Those were appropriate pictures. We did the so yeah, but it is possible to train yourselves as well as to train AI in order to try and look for early signs of feeling suicidal. This is an example actually that got me on this route. This is when my son was in middle school. One of his friends posted this picture. Tetris taught me that when you try to fit in, you'll disappear. And I thought about it, and I was like, I'm going to go back and I'm going to write something about this. And when I went back on, it said, like I said, I'm better off dead. I was like, whoa, I missed it completely. It's a picture of Wednesday. I was like, oh yeah, some of the goth kind of a vibe, but yeah, I had been working in the area and completely missed it. Now I see some of those cues. It's black and white. Like there's some of the things that we've learned through the work. So what happens when this is going on? Well, I think the number one thing, because people are always like, well, I'm not trained in this. This is not my area. What am I really going to do? Is that, first of all, listening is the best thing that anybody can do, whether you're a provider or a community member. We need people to give the space and grace so that they don't take their life. By and large, most people are not certain. They do know that they want to end the way that they're feeling, but they don't really want to end their lives. And so what we're trying to do is, once they're able to share their story, you take it seriously and offer them that message. By and large, that works for most people. Obviously, we saw the data, we saw the information on hospitalizations. There is a percentage, right? Of all the people that call the crisis lifeline 988, only less than 1% of those calls ever get referred, because most people don't need that, but 1% do, right? So we want that 1% to get linked in and contacted. So, but our first step is listening. And I think I said that. And this is just, I think it's super important to have a protocol if you don't have one. I know most places now are expanding that, and there's some great examples online in terms of what to set up and what that looks like and how it should flow. There's a lot of really good practices now that have shown to improve outcomes after people get discharged. And we'll talk a little bit about some of those, but even just that follow-up phone call or a follow-up postcard can be super helpful. And this is one example, and it's probably tiny depending on the size of your screen. This is from the National Institute of Mental Health. It says COVID-19. I don't know why. It doesn't matter whether COVID is there or not. I think it's because a lot of people implemented other types of screening processes, but then those have remained since then. So the idea is to ask and ask frequently. I mentioned the study that we did in Y&I. If we had not been screening, there were still some people that we would not have gotten referred, right? By screening frequently, we did it, that was annually, we actually did it at 3 months. There were still some people that we had screened initially, and then at 3 months, they still hadn't gone in for help early on. And so it was nice to continue to do that type of screening. When we screened at 1 year, and then we did we checked in on everybody that we had screened and referred, they all followed up. So there was definitely an impact of the program, but when there aren't programs in place, it's great to conduct that screening. And so this walks through that, and then what to do at different stages after risk is determined, because just determining risk isn't sufficient. We really need to follow that up. And say, now what are we going to do? What does this evaluation say? What safety measures need to be in place to keep people safe? What kinds of treatment programs do we need? And then some of those other things like safety planning, which we will be talking about. So the first part of that screening, though, is really, obviously there's multiple measures that you can use, but if you use nothing else, to ask, are you thinking of killing yourself? Are you thinking about suicide? I think the one that a fair number of people like, do you ever wish that you could go to sleep and never wake up? Like as a softer self. But ultimately we do not and never want to ask a question, are you thinking of hurting yourself in that way? Because they do not. They're thinking this will end the hurt. That's really the message that we try to get across with suicide. So if it's not that it's going to hurt. They really see this as ending the pain and suffering that they're feeling. And then just a reminder that asking this does not make somebody suicidal. Oh, now they have the idea. No, and I mentioned okay. So there's a couple of screeners. There's several that are available, but these are probably two of the most used. The AskQ was developed by NIMH for adolescents specifically, and then the Columbia is probably the most frequently used screener, I think. So no right or wrong. Personally, I just want people to screen. I don't whatever you use, and have a process for that. The recommendation is anyone over 12. As I said, as some of our data is getting into middle school and younger, I think there are communities where maybe you want to go younger as a routine, but that would be a question knowing your community. So right now 12. Makes sense. We do know that there's a rise that's related to kind of the school year. We see higher hospitalization rates right around now. But then as soon as break is on, then it tends to go down a little bit for adolescents. And then again, we'll see them in these transition periods, right, with the semester break. it's also recommended that anytime someone's coming in for a behavioral health visit, they would be screened. And then anytime you're concerned, there's the new studies that are coming out, because the federal government has stated that you can't be under 10 to be given a diagnosis related to suicide, and that was because they felt that people didn't understand the fatality right of their actions. But there's a whole bunch of work being done right now looking at under 8-year-olds to see what the understanding is, and so there may be some changes, but already they were already starting at 8, so my guess is kind of around 8, but this is an area that's being studied right now. So that's where the kind of the 12 was the age, 10, those are more with cause, and then what does it mean for some of the younger folks. And my chart reviews, I think the youngest I saw ever was that mentioned suicide was a 3-year-old in Hawaii. And this was years ago when we didn't have e-codes. Tells you how long I've been looking at this. But, and we weren't certain what to write, but the child definitely had been suffering a lot of abuses and seemed to want to end their life as a result of that. But whether that was suicide or not, that's the challenge, right? Do they understand what that means? So these are some, again, going back to listening as being our primary, like what can you do under offering help? And a psychologist, Uncle Ish, who worked with youth out at the detention center, used to say everybody needs pink when it comes to listening. I think you can use this in multiple forms, but it's that whole body listening, right? You want to listen with your heart, with your mind, with your gut, and with your body. And I think similar, this is the kanji for the word listen. And I just love that it's made up of your eyes, your focus, your heart, your mind, and your ears. It's like, wow, what a beautiful word. Right? And then this was one of the social media posts that was generated, and how to utilize that in terms of listening with your heart, and then how to validate. So I think it captures all the key points that we wanted to talk about in terms of listening. So then we do spend a lot of time, and we want to make sure that people know it's okay to ask for help. I just, again, since I put social media posts throughout here, this was a social media post generated for somebody that's struggling. And so, as I mentioned, when people are struggling, they're attracted to that black and white images. And so it was done in that way. Whereas, yeah, an orange and purple graphic may not appeal to somebody that's having a hard time. And this is a campaign that we did in Waimanalo. Again, just to talk about our strengths and resilience, but how would you reach out to someone if you wanted to get them help? And what they ended up generating is images saying, we're here for you, we're here for you. And so I'm going to just very quickly skim through some of those. And again, the idea is that everybody is there for you, and we want people to recognize folks you see in the community, the people you know, as ways to connect, to help. Then we want to always provide resources across the board. You'll see this in the safety plan, resources, resources, resources. This was the one, this again is another poster generated. And I don't know if you can see, but each of the raindrops, they say family, love, support, hope, friends. So this is a safety plan. There's a bazillion of them available on the internet. You can download them. They're free to do. There are apps. Lots of things in the safety plan. There are people suggesting that everybody should just have safety plans. When I do trainings in school, we do have people, we say, now is the time, we're going to ask you to take out your phones and let's put in some numbers and then let's talk about people. The ones I'm always concerned, I don't have anyone that I can list that an adult that I trust or I would be willing to talk to. And so, that's a little bit of time where we want to, see how we can get someone connected for that. Again, using that wheel, what are those strategies? Let's put those on. Where are those resilience things? What are you good at? What's worked for you in the past? All of those types of things are things that we want to capture. People or places that provide you distractions. So where can you go to get away from this, right? What's safe places, and thinking through that. And then professionals that you can and who you can ask for help. We actually, if you do this in advance, before somebody's in crisis, rather than at the end of a crisis, they can have that conversation and start talking to someone. And sometimes some of the adults aren't ready yet. They're like, oh, I don't think I can handle that. But you want me to do that? Maybe I'll sign up for a training and I'll learn how, to be more comfortable with this topic area. So that's another way to do it. And then also making sure that we talk about who our professional help is, as well as how to make the environment safer. One of the things that's come up specifically for Hawaii and other areas of the Pacific is that the leading means for suicide death is hanging here, and that's not true in other places. And when you look at lethal means restriction, making environments safer, a lot of it has to do with firearms. And so what do you do with hanging? And so the Veterans Administration in Hawaii has been working on developing lethal means restriction for hanging to talk about, what can be done for that. And so there are things that we can do. Actually, people are very specific when they think about suicide and the way that they're going to do it. And so it may be as specific as, I'm going to use the pocket knife in my desk drawer. Not any knife in the house. Now we wouldn't recommend just removing that one pocket knife. We do recommend that people store all sharp objects and get those out of the way. But they are very specific. And so when they think about hanging, that could be true as well. And so we are looking at that, and that's available. There are other things. I mean, just in general, if you're talking to parents, I recommend that people not buy any medications, over-the-counter medications at Costco, for example. If you have teenagers that are impulsive, they will take medications. There's no reason to have 500 Tylenol at your home. If you are, bring them to your office, bring them home in a tiny thing where you only have a small number, right? So some of those things, blister packs, other types of things are helpful, but there's also things that we can do well in advance. And also some of these take back programs now for medications, right? Just get old drugs out of the house. So because that's for our attempts, medications are one of the leading lethal means utilized. So. All right, lost my cursor again. I don't know where it is. Oh, found it. Okay, so let's talk a little bit about healing. So this is what is happening after a suicide death. It could be a family member, it could be a friend, it could be someone that a child might identify with, right? I mean, there are a lot of different things that we're looking at, and we have been working with schools to try and improve their protocols. But what we want to do is normalize grief as a process, right? It's to make sure that we're looking at what people want to do. A lot of times people say, I need to do something now. I'm going to have a walk. I want to put this on a shirt. I want to wear this. Is it okay? What does that look like? Can everybody wear that shirt? So you really need to balance, like, are we raising this to a level that somebody else that is feeling invisible might now want to take their life, and we have a contagion issue with, we want to respect and honor what people want to do. One example that I have, like this desire to do something, is a church decided to plant flowers after one of their youth group members died. And so they planted flowers all along the way to the youth program. And then they had us come in, and I said, "Oh, do you plant flowers after anybody dies?" And they said, "Oh no, we did this special because it was a suicide death." Well, that's something that can actually lead to somebody else, right? That could lead to a contagion. So we want to make sure we're thinking through and giving recommendations. Like, yes, when this is done, let's do it every time, right? Like if that's what you do next death, let's do that again when there's a death. So let's be looking at this. There's a park where somebody put a park bench under a favorite tree of somebody that died by suicide. And pretty soon the entire park was full of benches, and they call it Suicide Park. That is not what we're trying to do in our recognition and honoring of somebody that's lost to suicide. This is an example of a safe message post. The picture is and names have been changed just to give you an idea. If families are asking, like, what could I say? And this was an adolescent that died by suicide. And so they speak to the fact they were willing to be open, and they wanted they wanted to share this information. And so we are looking for connection. We are, as a state in Hawaii, and then in the Pacific, even less prepared to handle suicide death. There aren't that many programs for youth. Liliuokalani Trust has programs for children that have lost a parent to any kind of death. Kids Hurt Too is a great program, and the suicide groups for folks that have lost someone to suicide are based off of that program as well. But they don't specifically address suicide. So when somebody has had a suicide loss, there's not many places to refer them to. We have a lot of hospice. We have a lot that deal with grief, but not specific suicide loss. And we have heard from folks that when they bring up suicide, they feel excluded. It's very different from grieving from cancer, for example, right? If you've had a loss to cancer and people are open and everybody's saying how strong you are, and then now you have a suicide loss, and there's a lot of connotations about this being a weakness, and right, we're still struggling with the stigma. It's not the same thing. So we're trying to do better and getting those programs in place, and we do have to address a lot of the misconceptions, misinformation, but community connectedness can help, and bringing people together. Having music is great way for that to take place, and having a place for people to come and being able to talk. We tap again into our well, we call them inspiring hope through sources of strength groups, not just sources of strength, but those groups then can be tapped into because they are able to back to the resilience aspect of this, right? Back to all of that, those same strengths now are something that you can lean on when you're dealing with it. So we are looking at the connections. Number one, timing. This was an interesting area as we started to work locally. They said if a community could identify a suicide death in the last year, they probably weren't ready to start prevention efforts. And we're like, well, we're never going to have one. Our communities can identify them. They're connected to other communities again. And so then we started looking at other types of things for community readiness. natural breaks. So maybe not this semester. How about after the new year? Maybe we can do something then. Let's look for those types of breaks. For individuals, it's just like grief. It's, for some people, they're ready to start. For other people, it's going to take a very long time. I've encountered people that have it's been 20 years since they lost someone to suicide, and they're still not ready. They certainly don't want to talk about it. So it just varies. And then this is often brought up again in terms of how we pass life forward, that really we're looking at this as a cycle and the darkness and being able to preserve life. And so I think that's why so many folks do get tied into the prevention efforts after a loss. So I want to close by reminding you all to take care of yourselves. Remember, note to self, stay hydrated. Things that we don't do, sleep 8 hours a day, well, plus participate in activities and connections and wherever you have those. Stop share. I think I'm right at time. Is there any?
You are actually perfectly at time. That is very true. I don't see any questions in the chat yet, but if anyone does have any, before they have to rush off, please feel free to add them in now. Summer, I don't know if we had questions with this talk.
No, I don't see any questions.
Okay, sounds good. Okay.
And I popped my email in there if anyone had, and just feel free to reach out.
Perfect. I was just about to say, I just saw your email fly in there. Thank you so much for adding that as well. And thank you so much. I think that was a really, I agree with Dr. Who's saying, he appreciates your emphasis on using the right words. And I think we learned a lot about just kind of the communication around around how to best help care for these youth and the families. So thank you so much. Thank you for joining us, especially so close before the holidays. Thank you to everyone on Echo as well who joined us. Our next session, we're going to take a very quick break from our mental health series. On January 3rd is going to be our next session and our first session for the new year. It's going to be updates in RSV prevention. We have Dr. Jen Mutia coming back from Queens, the Queens Medical Center allergist, and I hope to see you all there. So happy holidays, happy new year, and see you all in 2 weeks.
Thank you,
everybody.
Lots of thank yous coming through the chat for you.
Thank you.
Thank you. Bye.